Dr. D. Pasquale from NSI, and I'd like to talk to you a little bit about neuropathy. And, there are many different types or causes of neuropathy, not necessarily types because it's all the same. It's nerve damage or dysfunction. That's what neuropathy means. And the mechanism is very similar for most of the causes, but, the three most common would be diabetes, post-chemotherapy, and chronic spine disorders, believe it or not. But we can also have heavy metal toxicity, B12 deficiency anemia. We can have, gluten sensitivity neuropathies. We can have autoimmune polyneuropathies. So understanding the cause is part of the puzzle, but then recognizing that there is damage and dysfunction where that nerve is also part of the puzzle. And the reason why we can be successful in treating neuropathy with stem cell therapy is primarily because we now have the ability to repair and regenerate tissue. And the primary component for neuropathy is those small capillary networks that become compromised, and as a result, the blood flow doesn't get to the nerve, and it dies. It becomes dysfunctional, and as a result, we get tingling and numbness and pain and those types of things. What stem cells do, or stem cells derived from fat, one of the primary mechanisms is they promote angiogenesis, which is the production of new blood vessels. That's a really important distinction, and it's really important because now we can drive blood flow to the damaged nerve and allow it to heal. And the thing is, peripheral nerves heal. They're dynamic. Central nervous system, brain and spinal cord, that generally doesn't heal on its own. Obviously, we have some mechanisms with stem cell therapy now, which is really exciting. But with peripheral nerves, we know, and it's well established in the literature, that they do heal. So giving them the proper blood flow, but then also affecting the nerves in a positive way using stem cells as well, is a really important, part of the process, and it really allows us to get our patients who are suffering with, severe symptoms to help them overcome that. In some cases, it really just depends on the individual, and we'll be really upfront. Sometimes it's just too much to overcome, but we never know until we actually do the evaluation with the patient in terms of what you're dealing with. In terms of the causes for neuropathy, that has to be taken into account, and it's absolutely something that we will address. If there is a diabetic component, then we're going to talk to you about diet and lifestyle. We're going to talk to you about the things that we can bring to the table. If there's an anemic component, we're going to figure that out, and we're going to make sure we compensate. If there's local edema and swelling, we're going to talk to you about how we can deal with that. At the end of the day, the goal is to obviously improve function by addressing the damaged tissue itself and improving the quality of your life.
I was diagnosed with peripheral neuropathy in probably July of 2018. Peripheral neuropathy was basically from my knees down to my toes, tips of my toes, which just had quite pain, electrical, severe heat, severe cold, numbness, uneasy balance. Turning was in the evenings. It would get gradually worse throughout the evening to where I went to bed. I'd have to hold my feet and toes like clamps with my feet, and that kind of just put me at ease, but really didn't do anything for the pain or the cold. I found out about Stem Cells of America through my best friend, and it was October of 2018. There was basically a slow, gradual progress away from the pain and feeling return to my body, basically from my knees going towards my feet. And my mobility now is pretty much back to what I was pre-diagnosis of the diabetes and peripheral neuropathy. Like I say, now I can walk throughout the evenings where before I was stumbling or falling. Well, since coming and getting my treatment, Stem Cells of America, I've been able to get off of a gabapentin, which was somewhat of a pain medication for me. Just kind of made you a little cloudy and foggy. So since the treatments here, I no longer take any pain medication of any sort and really feel amazingly well now. Seriously, I really felt that I was dying, just like a continually down, and where now I'm continually up to the point of now I feel basically that I can do anything I could 10 years ago. You know, I feel youthful, energetic, able to take on challenges, go further than I'd ever imagined I could be at this time.
Hello, my name is Danny, and I have had a problem with neuropathy in my hands for almost 4 years and in my feet for almost a year and a half. I've seen doctors from neurologists to rheumatologists to acupuncturists. No one's been able to do anything that has helped remedy my problem. I went to a seminar about coastal integrative and stem cells, and talked to Dr. Steflik about possibility of a treatment. It's kind of a new venture in this area for them as well as myself, but we decided on a course of action because stem cells have proven themselves in other areas. So some of my goals and some of the things that I've wanted to do have been walk the beach and play golf. I've not been able to do those for several years now. And after about 6 weeks worth of therapy with stem cells and laser, I was able to walk up to 2 miles just last week on the beach. So I'm very excited about continuing my treatment with Coastal Integrative and the stem cell research and the laser treatment. And I'm very, very pleased up to this point about how things have went. So I'm looking forward to continuing to get better.